So previous lecture, we finished this topic about muscle contraction, molecular mechanism contraction. And I would like to remind you that muscle contraction we have after transferring of electrical signal to mechanical signal, transformation from electrical signal to mechanical signal, named as electrical mechanical coupling. And we have with you next step that calcium, ions of calcium should be released from endoplasmatic reticulum, and as a result, they should contact to special proteins upside of actin, protein actin. Calcium joined to troponin, troponin changed to conformation tropomyosin, and as a result, with using of ATP energy, we have connection of myosin head with actin, and after we have with you movements of myosin head, and as a result we have with you muscle contraction. I would like to remind you that if we're talking about muscle relaxation, this time we are talking about disconnection calcium from troponin tropomyosin system, and when calcium turning back to the stores, as a result, we have with you muscle relaxation. This is important question because so often in different variation you could find this question in Krok questions. One of example like that question, I would like to demonstrate for you. Look, during the experiment on the influence chemical substances in the muscle, the reaction of calcium pump is weakened. Which phenomenon will be observed? If we are talking that calcium pump is weakened, it means that calcium is not turning back in time to the stores and or will be not good working. As a result, we will have with you prolonged relaxation. I would like to remind you also the next question about muscle contraction mechanism. Here we're talking about that phases of muscle contractions. This is latent period. This time from the moment of irritation to the moment start of contraction time or shortening phase. Second, this is shortening phase, and third, this relaxation phase. And important for us which moment we will send with you next signal about electrical signal. Which moment we will send next signal, it will be depends on a type of muscle contraction. And also important moment that here already working other law, because we were talking with you that last lesson that most of cells working according law, all or none. But this case, if we are talking about nerve, not nerve fibers, but nerve, if we are talking about muscle, this time we are talking about power-law relationship. Power-law relationship. I would like to show you this picture. Look, please here. What they say. Please pay attention. That then higher irritation stimuli, voltage of stimuli, then more contraction we will have with you. What does it mean? This is power-law relationship. How is it working? For example, some signal not enough to threshold level, not enough to threshold level, we not have any answer. After we reach to threshold level, next signal higher, and this case, for example, also we excited only one muscle fiber. Higher voltage of the signal, we activate few fibers, more fibers, more fibers, and more fibers. In the moment when we reached maximum contraction, when we excited all of our fibers, what we have in our muscle, this time increasing of stimuli will not increase force of contraction. This name power-law relationship. And one of the example of question, what could you find? When measuring total muscle action potential, it was subject to the power-law relationship. The reason for this is that individual muscle fibers differ in depolarization threshold. What I say, the different fibers inside one muscle, there is different threshold level. And when we reach all muscle threshold, this time we will have with you maximum contraction, and increasing force of irritation will not change our muscle contraction. Also, what should you remember? This frequency of irritation, I remind you, what does it mean? It means, look, next. If next stimulus we will make after full muscle relaxation, we will have with you again single contraction. If next irritation will become during period of relaxation, here or there, but it's continuing relaxation, this time we will induce with you incomplete tetanus or incomplete tetanic contraction. If next irritation will come during the phase of contraction, this time we will have with you complete tetanus or complete tetanic contraction. It means that muscle not have time for relaxing and continue contraction. Important to pay your attention that this time we will have with you amplitude of muscle contraction higher than for a single contraction. Why it's happened? Because calcium ions not turning back to the storage and muscle contraction increase in their forces because more contact between myosin and actin. This important. Then more contact between myosin and actin, then more force of muscle contraction. This is rule you should memorize and remember this. A few example of question, what could you find? Let's look. In course of an experiment, a skeletal muscle is being stimulated by a series of electric impulses. What type of muscle contraction will arise if every subsequent impulse comes in the period of shortening of the previous single muscle contraction? This is what we have been talking about, and here we know with you if we are talking about period of contraction next stimulation. This time we have with you complete tetanic contraction. I want to pay your attention for this example of question. Why? Because here they use it little different term for you not mix it in your mind. It's the same, complete tetanus, hollow tetanus, and smooth tetanus. It's the same meaning. So our answer here will be it's smooth or hollow tetanus. Isolated muscle of Krok is rhythmically irritated with electric impulses is the next question. It is next question. Every next impulse is in a period of relaxation from the previous contraction. What contraction of the muscle appears? So we say if we are talking the next in the period of relaxation, this time we are talking about incomplete tetanus, or they can use waved tetanus. From the name, you could understand that they are meaning incomplete tetanic contraction. What else should I remind to you? It's about type of muscle contraction, isotonic and isometric. Example also, isotonic contraction, muscle contraction, they change the length of the muscle but doesn't change tone of muscle contraction. For example, when we are talking about isotonic contraction, when we are biting our arm, for example, or our finger, it will be isotonic contraction. Length of muscle is changed, is shortened, but forces is not changed. Isometric contraction, when muscle contraction length of muscle not change, doesn't change, but this time we are talking about change of force of muscle contraction. Tone is changed. Why? This example, good example for these exercises, when muscle tone is increased so much, I think even once time in your life, but you have tried to make like this exercise, but length of the muscle this time is stable. So it's what should you remember? And example of question: which muscle contraction will be observed in the upper extremity during holding, not moving, a lot in certain position? If not moving, we are talking about isometric because we not have shortening of muscle. What kind of muscle contraction occur in the upper limb during an attempt to lift a load beyond one's strength? Here we are talking about isometric because we are trying to lift, but we cannot do that because so high weight. It also will be isometric contraction. And now we will talking about the next topic, the role of different levels of the central nervous system in the regulation of motor function. And also today we will talking with you about autonomic nervous system, because so many questions like that have in Krok question. And also today we will talking about humoral regulation, main mechanism, main question, what you should pay attention. So let's move. Nervous system, according to anatomical classification, we have with you a central nervous system and peripheral one. Central nervous system consists of brain and spinal cord. That's all. All peripheral nerves, this is a peripheral nervous system. According to physiological classification, we could say with you that nervous system we could divide for somatic and autonomic nervous system. What is the difference? I think you remember that somatic control our skeleton muscles, our responsible for our sensitivity from our skin, but autonomic system control only our internal organs, visceral system, and could not be under control of our brain cortex. So we cannot control autonomic nervous system work. I have other one type of classification of nervous system, like central brain spinal cord, and peripheral one we can divide it for autonomic and somatic. It's maybe not so clear classification, because here we are able to see with you that only like peripheral responsible for regulation, but it's not true, because of all of regulation created and controlled by our as minimum spinal cord, and of course most of action controlled by our brain. Neurotransmitters. Last previous lecture I was talking with you about neurotransmitters, and I showed to you small video where you could see process transmission from nerve to muscle. Today we are talking about transmission from nerve to other nerve cells, neural cells, and in this case we are talking about next process. I remind you that inside of our central nervous system, we have two main processes between nervous cells. This excitatory process and inhibitory process. And because of balance between these two systems, we have with you normal work of our nervous system. What should I say? What would I like to say? Look, please, we have excitatory and inhibitory synapses. Excitatory synapses, they have different neurotransmitter inside of our nervous system. Here we could say and about glutamate and acetylcholine, epinephrine, dopamine. I'm sorry. What else? Norepinephrine, serotonin, and so on. When we are talking, and important, when we have releasing with you excitatory neurotransmitter to the postsynaptic membrane, as a result, we have with you reaction of excitation. What does it mean? It means depolarization. Depolarization. If we are talking about inhibition, so about which process should we say with you? If we say inhibition, what should be happen? This question to you. If excitation, this depolarization, so inhibition, it will be? Okay, my students are sleeping, so nice. If depolarization, this excitation, so when we are talking about inhibition, we are talking about hyperpolarization. Hyperpolarization. And upside of postsynaptic membrane, we have more negative charge. As usually, it's happened by two processes, I remind you. If depolarization, it's always because of enter of sodium. Hyperpolarization, we are able to have two mechanisms. First, this is entering of chlorine ions or moves out ions of potassium. Depends on mechanism and depends on type of receptors which will be activated on the postsynaptic membrane. Main inhibitory neurotransmitter, it will be GABA. Please, you should memorize it. This for all subjects, you should know this GABA. And glycine. GABA and glycine, two main inhibitory neurotransmitters. As a result of their action on the synaptic membrane, we have with you postsynaptic membrane, we have with you inhibition. It means that from MRP, some level MRP is increased its level. It means that value is grow up, and it means that we have with you inhibition. When we are talking about depolarization, this time we are talking about decreasing of MRP value, and this time more easy to induce new action potential. I would like to show you a picture from the right side, because it's usually when we are talking with you about synaptic transmission, you could see a picture like that, like one axon and one body cell or something like that, and this is connection. No, look please this picture.
I have a
Yellow.
question, please.
Please.
Sorry.
Mm-hmm.
So we mentioned GABA here. Can we say GABA like it's gonna be bonding during the brain to calm over neural activity, like it's like reducing anxiety.
Absolutely. It's a perfect method, I will tell you. And sometimes when we are so excited because of some process inside our life, GABA, this is one of the easiest way for calm down people, for concentrate these substances, use it for concentrate attention, for decreased domination of excitation in central nervous systems. This is perfect variant, and this usually have two type of treatment, or they use directly GABA, or they induce a substance which induce releasing and synthesis of GABA in our central nervous system. By the way, now I remember, I will tell you, in our cerebellum, you know, our cerebellum, part of our brain, cerebellum, main function of cerebellum, this is function controlling of our movements. And what is interesting, I would like to give you example, only for you more good memorize this question. When we in our life, once time or not once time, you could see drunken people. Why I'm talking about them? Because you could see that drunken people, they are not able to control their movements. Doesn't matter, it's their movements of their body or movements of their tongue. I am not talking already about their minds, talking about movements. A main neurotransmitter of our cerebellum, this is GABA, main neurotransmitter. So main function of cerebellum, this is inhibition of all extra movements, what we not need with you. And why I'm talking about drunken people? Interesting fact that alcohol blocking releasing of GABA, blocked. And it means that all this not control movement because of lack of GABA. And people, for renewing their function, they need for stimulation this GABA production. When alcohol moves out from our body, GABA production increase, and we have normal feeling, or people who has problem has normal feeling. And by the way, abstinence syndrome, when people drug dependent or alcohol dependent people, they also have problem with production of GABA. And you could see that during abstinence syndrome, they have like trembling. It's also because lack of GABA. So yes, a very nice question, Aravat, and it's really right, and very good treatment, very good help, even but not so serious, not need prescription from a psychiatrist doctor, for example, but it could help for concentrate attention and for little bit relaxing in our life. You are absolutely right. So I would like to pay your attention for this picture with synapses. Look, this yellow color show it and colored connection between different neurons on the one neuron. This all spot, this all new synapses. You could imagine how many synapses we have upside only one cell, and billion synapses are contacted inside of our nervous system. And when we are talking about growing up of our brain or development of our brain, we are not talking about creation new neural cells. No, we are talking about creation new synaptic cleft, new synaptic contacts. Then more synaptic contacts, then more will be developed connection inside of our brain. Few moments, what I would like to remind you also, I found last year like this question inside Krok, that why I want to pay your attention here. Look, what we have with you inside of, because I say that we have many neurons, the same time they send signal upside other neuron, in our central nervous system, important moment, this summation. And usually it's working by next way. Upside, look here, upside one cell, we have the same time coming many signals. The same time, it could be excitatory signal, it could be excitatory and inhibitory signal, or only inhibitory, doesn't matter. But as a result, who will be dominate, which signal will be dominated? This reaction will have neuron. If we have domination and summation of excitatory signals, this time we will have with you action potential, and we will have depolarization and irritation, excitation. If the same time we will have an excitatory and inhibitory signal, this time we are talking about a spatial summation, but important which signal will be dominant. If domination will be from inhibitory signal, more signal inhibitory than excitatory, this case we will have with you inhibition. And two type of summation, I remind you only, temporal and spatial summation. Temporal, this when from the one neuron moves signal on the body of the cell with very high quantity signal. And because of high quantity of signal, happened summation this small signal. It's named as temporal summation. And we will have with you reaching of threshold level, we will have with you action potential. It could be from different neuron, different excitatory synapse. We will have with you spatial summation. So temporal one with high frequency, spatial this few the same time sending signal, and we have with you anyway summation. Example, one second, because not good you could see. Example, an experiment was aimed at testing flexor reflex in a spinal frog. Spinal frog, I remind you, this frog after decapitation without influence of the brain, which was initiated by simultaneous stimulation with isolated pre-threshold electrical impulses. Most of impulses pre-threshold level, but after summation, they induce some reaction. The frequency of those impulses such that the reflex occurred. What process in nerve center can be observed during the experiment? So here we have if few impulses from few synapses, it means that we are talking about spatial summation. And remind you a few terms also. When we are talking about connection between neurons, here we are talking about feed-forward excitation in one direction, lateral inhibition. Lateral inhibition when one neuron sending signal to other neuron, excitatory, and the same time collateral sending to the inhibitory neuron. You could see. This inhibitory neuron sending signal to lateral cell from our excited neuron. And as a result, we have inhibition of lateral cell through the using of inhibitory neurons. Also, feed-forward inhibition. If we will send signal to inhibitory neuron, it's able to stop at work of forward neuron. A feedback or recurrent inhibition. Same story, but when we send signal to some excitatory neuron, it's able to send collateral signal to the inhibitory neuron, and cell by itself will induce inhibition. Feedback, excitation, it's not so often happen in our body, but also possible. And two also important term, convergence and divergence, or convergence and divergence. Convergence, concentration of signal, look, from many neurons to one, and divergence from one to many neurons. For example, by this way, working our sensory system. First signal, for example, from many receptors of our skin will be convergence induced to one neuron. After it will be moves to different neuron of our central nervous system. And one more, reciprocal inhibition. What does it mean? I gave you example on the picture. When we are talking about reciprocal inhibition, we are talking about our locomotion, our movements. This term, you should memorize it and should remember. So I would like to recall you. Inhibition of alpha motor neuron of the extensor muscle was noticed after stimulation of alpha motor neuron of the flexor during the experiment on the spinal column. What type of inhibition can this process cause? What does it mean? Our muscles for our limbs working always for antagonism. One muscle contracted, at the same time other one will be in the pair of the muscle will be relaxed. For example, biceps and triceps. When we have contraction of biceps, the same time we have reciprocal inhibition and we have relaxation of triceps. And opposite, when we have excitation and contraction of triceps, the same time we have with you relaxation of biceps. The same with our low limb, with our leg, with our foot working by the same way, and its name as reciprocal inhibition. Okay. Extra question, what you could find in the Krok question. When we are talking about base working, the base of the work of our nervous system, we should talking about reflex arch. Reflex arch, we have different types of reflex arch from different sensory system, but main components of reflex arch, it will be receptor, sensory neuron, central nervous system, and motor neuron or efferent neuron and organ effector. What do we have here? Here important to know that the biggest delay of signal happen inside of central synapses. Central synapses, this is synapse, these synapse inside of our central nervous system. Cause we say with you that we have delay for coming signal to presynaptic membrane, releasing of neurotransmitter, movements of neurotransmitter to postsynaptic membrane, and then more interneuron we will have inside of our reflectory arc, then more delaying we will have for transmission of a signal. And a few questionless example. A sportsman was examined after intensive physical activities. Examination revealed disorder of movement coordination, but the force of muscle contraction remained the same. It can be explained by retarded speed of excitement conduction through. The biggest, again, delay happened in the central synapses. And second question, After a long time, long training session, sportsman has developed fatigue accompanied by abrupt performance decrement. What link of the reflex arc was the fatigue initiated in? When we are talking about fatigue, I will remind you that when we are talking about fatigue, tiredness, we are talking about two mechanisms. First one, it's happened inside central nervous system. Firstly, we are tired by nervous centers. Second, we are tired peripheral fatigue we have, and peripheral fatigue, it means that we have decreasing of neurotransmitter from nerve to muscle, we have decreasing level of ATP, and so on. So first of all, we are talking about fatigue in nerve centers. Motor units, also important moment about talking about when we are talking about regulation of our muscles work. Here we say that motor unit, this one motor neuron and muscle fibers which receive signal from one motor neuron. We have big or huge motor units and small one. Big, this one we are talking about muscle of our back or abdominal muscles, some huge muscles which not need some acute controlling. But when we are talking about muscles and controlling work of our face muscles, or when we are talking about our fingers muscles, this time we are talking about small motor units because need very high level control. And because we start talking, we will start with you moves from spinal cord. I remind you that we have with you enter to spinal cord by afferent way, and efferent way moves outside. Afferent way, this dorsal root. Efferent way, this ventral root. So many questions will be from anatomy and physiology, and not only for this question. So enter information by dorsal, moves out by ventral roots. Afferent and efferent one. Example of question. The ventral roots of fifth frontal segment of spinal cord were cut during experiment in the animal. What changes will take place in the innervation region? Doesn't matter number of segments, important here ventral roots. How I show to you, if we are talking about ventral roots, this time we are talking about efferent information. Efferent, so this information will be about movements. And opposite question, during an experiment, the dorsal root of spinal cord of an animal have been cut. What change will be absorbed in the innervation zone? So if we are talking about dorsal root, we are talking about afferent neurons. This time we are talking about sensitivity loss. I remind you that our spinal cord consists of 31 segments, 31 pairs of nerves, different part of our spinal cord. Here we have cervical, thoracic, lumbar, and sacral part. Spinal cord function. This is spinal cord reflexes, integration of nerve impulses, and of course it's about highway for upward and downward travel of sensory and motor information. We have different pathway, efferent and afferent tracts. Here I would like to give you only as example about this pathway equation. First one, an animal has an increased tonus of extensor muscles. This is a result of intensified information transmission of the motor neurons of the spinal cord through the following descending pathways. Here we are talking about vestibulospinal vestibulospinal way, vestibulospinal tract. We are talking about efferent way. As a result of spinal cord trauma, 33-year-old man has disturbed pain and temperature sensitivity that is caused by damage of following tracts. Here we are talking, if we are talking about sensitivity sensation, you should memorize this time, you all time thinking about thalamus, because all of our sensitive information will be connected through the thalamus. So it will be spinothalamic pathway. Here we have afferent tracts, spinothalamic tracts. One more question. During an experiment, the myotic reflex has been studied in frogs. After extension in a skeletal muscle, its reflectory contraction was absent. The reason for it might be a dysfunction of the following receptors. Inside of our muscle, we have spatial proprioceptors. They are named as muscle spindles. These muscle spindles receptors, they are responsible for controlling of muscle contraction, and they are responsible first of all for myotic reflex inside of our muscle. Myotic reflex locked on the level of spinal cord, and myotic reflex, look here, is a reflex arch starting from the muscle spindle, and moves to the normal our muscle fibers. Also, on the level of our spinal cord, we have reflexes, which named as tendon reflexes. Tendon reflexes locked on the different level of our spinal cords. That's why neurologists, doctors usually use this reflex for investigation state of our nervous system and connection on some level of spinal cord. That's why they know that, for example, tendon reflex for biceps, triceps locked on the level of cervical level on our neck. Or, for example, important for us, reflex from patellar or quadriceps or knee reflex, we name it, level L2, L4. Achilles reflex, it's level S1, S2. Example, we have been studied with you on the physiology classes that this reflex, tendon reflexes, has two phases. First phase started from the tendon. First phase started from the muscle spindles, and second phase, what you should know, they start from the tendon receptors. So, example of the question during examination of a neurologist taps or neurologist hammer on the tendon under the patient kneecap with the reflex hammer to evaluate reflex extension of the knee. The response is provoked by stimulation of the following receptors. Tactile receptors of the skin, no. Muscle spindles, no, because this is first phase, but name of reflex, tendon reflexes. So we are talking about tendons, receptors, or Golgi tendon organ. Nociceptors, no, should be not feeling pain, and articular receptors, of course, no. So here you should memorize and connect it to terms. This is tendon reflex, tendon receptors, and Golgi receptors. It's the same name, tendons receptors or Golgi tendon receptors, same. Skin muscular spinal reflex. You know this reflex from your life so good. Because this reflex, we use it so often in our life when we are talking about damaging of our skin, when we are touching too hot surface or to damage it, cut it somewhere our skin. This time we have with you very good, we can observe with you skin muscular reflex. From the receptors of the skin, move signal to our muscles, and we have with you reaction for moves out our some limb or upper limb or down limb, doesn't matter. So like this picture, I would like to show you and remind you this picture. When you will pass Krok exam, you will transfer to fourth course, and there you will start to study neurology. And during neurology, you will be back to this scheme, because this scheme show to us and demonstrate to us the map of our body. Here we are talking about different part of our body and different segment of spinal cord, which controlling this part of the body. You could see, look, so interesting. See segments, cervical segments, thoracic segments, lumbar segments, and sacral segments also here. About face, I would like to remind you that only our face is not under control of spinal cord. Our face under control of cranial nerve. And here, first of all, we are talking about trigeminal nerve. This is fifth cranial nerve, and represented by number 5. Dermatomes or dermatomes, these parts of our body or areas of our body on the skin, supplied by sensory fibers of the spinal nerve. From dermatomes, this is numbered, sending signal to the spinal cord, for example, to C6, C7, T4, and so on. And I would like to remind you about spinal shock. A long time ago, I saw like this question in Krok, but everything possible. So I remind you, spinal shock, this is temporary absence of reflexes below the level of damaging spinal cord. As example, you see C4 damaging, C6 damaging, T6, L5 level also damaging. What does it mean? It means that for some period of the time will be absent all reflexes which located on level below these numbers, below place of damaging. What does it mean? It means that spinal shock, as usually has a long time duration for human, 3 till 6 months, all reflexes could be absent below the place of damaging. Mechanism, I remind you, mechanism of areflexia. This is developed of hyperpolarization on the neurons of spinal cord below place of damaging, because most of signal which sending from our brain to our spinal cord, this is excitatory signal, and when this connection is stopped, develop of hyperpolarization. After 3, 5, 6 months, this process is stopped and begin depolarization, and reflexes are renewed. So spinal shock will be finished. But voluntary control from the cortex will be never renewed. This is, you should know, I think you know that if, for example, some person lose connection between brain and spinal cord till the level C4, everything what is below place of trauma, yes, reflexes will be renewed, like tendon reflexes or skin muscular reflexes or myotatic reflexes, or what kind of reflexes which locked on them spinal cord, visceral reflexes, urination reflex, defecation reflex, they will be renewed, they will again working, but only as reflex and without any voluntary control. It means that this person will be able to, for example, if level of C4 only talking and eating, breathing. If we are talking about C6, the same but normal breathing with all respiratory muscles. T6 will move hands, will be able to put up upper part of the body, but not able to sitting, you see. And L5 level, able to sitting, able to turn a body, but not able to move their foot. Also, we have, maybe will be this question, maybe not. This is skin receptors through the locket on the level of spinal cord. We are talking about superficial reflexes from the skin of our foot. And here we are talking about reaction of the toys. If normal condition, we will have with you, adult people will have with you flexing of the finger. This way of checking state of development nervous system for newborn baby. After birth, after 2-3 months after birth, this reflex should be working as for adult people. But at the same time after birth, we have opposite. We have extension of toys on our foot. That's interesting question. And let's move to our brain. Here we have is your hindbrain, I remind you. Here we have is your midbrain and forebrain. About cranial nerves, I will not say you something because you should study this from anatomy. Only I want to pay your attention that we have with you 12 pairs of cranial nerve, and some of them only sensory, some of them mixed, some of them motor. What are mixed? Here is marked as red color, and here what is mixed, what is not mixed, what is motor. There show it as green color, and only sensory showed as only blue color. Brainstem. About brainstem, I should tell you remind you important information that when we are talking about brainstem, we are talking not only about regulation of motor function, but we are first of all talking about so many visceral centers of regulation. This is important. Here we're talking about 1 minute. I will be back to medulla oblongata and 2 points, but I would like to pay a few seconds of your attention for other structure, which named as reticular formation. Reticular formation consists of about 40 nuclei that are part of medulla and bridge and midbrain. Has direct links with spinal cord, with non-specific thalamic nuclei and other departments of nervous system. Our reticular formation, this is like acumen of our brain. When we are talking about concentration of attention, receiving information from around of us, all this information also moves to reticular formation. And because we have this conscience, this only because work of this formation. Then less information will be moved inside reticular formation, then less activity will have our brain. And for example, we will sleeping with you when our reticular formation will be so low activated. Reticular formation receive afferent information from somatosensory system, visceral, proprioceptor, visual analyzer, and auditory analyzer. Also influence from send influence to skeletal muscles. Here we have with you descending pathways from reticular formation, this medial reticulospinal way and lateral reticulospinal way. Medial from Varolles bridge, lateral from medulla oblongata. But medulla, I would like to recall for you that when we are talking about medulla, we are talking about important visceral centers, cardiovascular, respiratory, and also protective reflex like vomiting, coughing, sneezing centers also located in the medulla oblongata. Also, nucleus of 5th and 12th cranial nerves originates in the medulla also. One of the Krok question example, patient with disturbed cerebral circulation has problems with deglutions. What part of brain was damaged? We are talking about this type of reflexes, and this case we are talking about brain stem. Brainstem role for regulation of moving reflexes of moving function. Here we have like a locate of next reflexes as static vestibular, postural reflex, static rightening reflex, static kinetic reflexes of angular acceleration and linear acceleration. Remind you what all of this means. Static vestibular reflexes. First of all, vestibular postural reflexes. We are talking that these reflexes arises from vestibular receptors, which located in a saccule and utricle of vestibulum. With the change of head position in space also. Here is important moment. Vestibular receptors by 8 cranial nerve please pay attention here, sending signal to Dayter's nuclei. Dayter's nuclei or vestibular nuclei, it's the same. Dayter's nuclei or vestibular nuclei sending signal to our body for muscles extensors, for muscle extensor, for muscle flexors, sending signal by red nuclei of midbrain. And balance between red nuclei and Dayter's nuclei, as result, we have with you normal body's control. But when we are talking about experimental damaging between midbrain and medulla level, we are talking about decerebrate rigidity. So often have these questions, that's why please also pay attention. Decerebrate rigidity, this time we have absence of influence from red nuclei of midbrain, and we have only influence from Dayter's nuclei or vestibular nuclei. This time we are talking about reaction extension. And example, in the experiment, an animal had its brainstem cut, which caused a rapid increase of extensor muscle tone. This is one of the example how it could be this question. This condition arose because the muscle were no more under control of the following brain structure. And again, I pay your attention, which structure we're losing? We lose in this case red nucleus of midbrain. A static rightening reflex and static, by the way, the same postural reflex. We are talking about changing position of the head up, down, different side, and this time you are feeling how change tone of your muscles also. If you will be absolutely relaxed and you will start to move your head, you will, but slowly, you could feeling how change tone of muscle in your body. It's working, for example, when we are trying to balance our body, when we are moves in some transport, for example. Example also question, surface with an intact thought on it was inclined to the right. Tone of extensor muscles became reflectory higher due to the activation of following receptors. How I put your attention when we are talking about static reflex, vestibular, postural, or static rightening reflex, we are talking about receptors, vestibular receptors, and we are talking about saccule and utricle. Statokinetic reflex of angular acceleration. Here we are talking about movements of semilunar channels of our vestibular apparatus. Here we have with you angular acceleration like picture upside, or we are talking about linear acceleration in a horizontal or vertical plane. And if we are talking about semilunar channels, so the same time you do connection. Here we are talking about or angular or linear. First of all, about when we are when we are talking about acceleration movements, we are talking about statokinetic reflexes, and when we are talking about statokinetic reflexes of angular acceleration. The same time, we are talking about semilunar channels. Semilunar channels. What else? The role brain of brainstem in carrying out primary orientation reflex. So many questions could be also about this one topic. Orientation reflex, this reflex of Pavlov, he is described and discovered this reflex. He named this reflex as, what is it? What is it? Reflex locked on the level of midbrain. Level of midbrain on the tectum, on the level of quadritubercular bodies, or quadrigeminal bodies. It's same. This time we are talking that superior part responsible for optic center, but inferior part or inferior colliculus responsible for auditory information. And if we hear something, for example, backside of us, some noisy or some, I don't know, someone crying or something like that, automatically we are turning back this side our head. Automatically, this is normal work of our reflexes. Orientation reflexes, please remember this. Let's move supper. Here we are talking about next connection, brainstem sending signal to the thalamus. Thalamus has connection with cerebellum and basal ganglion, all of them sending through the thalamus, sending signal to cerebral cortex. Cerebral cortex moves down signal to thalamus, to cerebellum, basal ganglion, and moves down to our body. We will have like integration of our signal. Okay. Cerebellum, I haven't talked to you already today about cerebellum. Main neurotransmitter is GABA. Main function, this is inhibition of all extra movements. For inhibition, only one way of movement, what we need in our life. I want to show you this input signal. Look, input signal to the cortex of our cerebellum, and output. Here we have with you interneurons, and interneurons moves to the GABAergic cells. GABAergic cells. So as a result, output will be inhibitory. This important moment. Symptoms that occur with damaging or some dysfunction of cerebellum. Name of symptoms I will read to you. Here we have ataxia, evaluation of motor coordination, asthenia, reducing of muscle strength, dystonia, violation of muscle tone, dysmetry, violation of movement amplitude. Astasia is not ability to perform precise movements. Disequilibrium, violation of balance. Dysarthria, speech disorders. Intention, tremor, shaking muscle when performing voluntary movements. Finger nose test, you remember? Fingers nose test show to us working of our cerebellum. If begin shaking, it could be testify about problem with our cerebellum. Eye nystagm, dizziness, vegetative disturbances also could be problem with cerebellum. Few questions. Due to cranial trauma, the patient developed the symptoms: intention, tremor, dysmetry, dysarthria, and so on. So when we are talking here like these terms, we are thinking about cerebellum. 50 years old patient was injured on occipital region of the head. The closed skull trauma was diagnosed. She is taken to the hospital, the medical examination on deregulation of walking and balance, trembling of arms. What part of brain was injured? Of course, again, cerebellum. Here you could see thalamic nuclei. Thalamic has few parts. Thalamus, we have with you sensory part of thalamus. We have non-specific nuclei and associative nuclei. Sensory parts, here we have specific nuclei. Each of these specific parts receives signal from some specific system. Non-specific, here we have like continuation of our ACUM battery of our brain. Non-specific nuclei and associative nuclei, here we have like accumulation information from specific, non-specific thalamic nuclei. The main what you should memorize about thalamus, this is under core level of integration and analysis of all our sensory information. All sensory information except of our smell system moves to thalamus. Also important moment. Basal nuclei. Under cortex nuclei, you remember that upside of our brain hemisphere, we have with you gray substance. Downside moves white substance. Inside of white substance, we have with you gray nuclei. This name is basal nuclei. This is their structure. Obligatory contact to thalamus. And main function. Pallidum, support of proof pose, subthalamical nuclei, responsible for moving of structure with contralateral side disappears. Big amplitude movements, corpus striatum, inhibition of moving structure disappear. Substantia nigra. Substantia nigra, this part of midbrain, cause destruction of dopaminergic neurons. Because of the drug, the concentration of dopamine decreased. This is, we are talking about damaging. If we have damaging of substantia nigra, this is, we are talking about Parkinson's disease. Main 3 symptoms of Parkinson's disease: rigidity, tremor, and arbitrary movements are reduced. Example from the right side of question: Parkinson's disease is caused by disruption of dopamine synthesis. What brain structure synthesis is these neurotransmitters? We are talking about substantia nigra. Basal ganglia connection. You could see main signal moves by GABA again. By GABA also we have glutamate, acetylcholine, dopamine. This is main neurotransmitter of our neural system. And of course, when we are talking about our cortex, here we are talking about sensory areas of cortex, somatosensory, taste, olfactory, visual, and auditory system. Moving areas of the cortex, what we are talking about? We are talking about premotor, primary moving cortex, and associative areas, this frontal part, temporal part, and temporal occipital part. Here we have integration of all our function inside of our sensation, motor function, decision, our everything what is happened inside associative areas. When we are talking about creation of conditioned reflexes, we are talking about associative cortex. Example of question. During brain surgery, stimulation of cerebral cortex resulted in tactile and thermal sensation in the patient. What gyrus was stimulated? Of course, we are talking about a postcentral gyrus, or what is responsible for sensory information, or it's named as primary sensory cortex. Primary sensory cortex. If we are talking about primary motor cortex, we are talking about premotor area, primary motor, nearly sensory cortex, you see here. Nearly we have premotor cortex, this part of our brain responsible for our movement and control of our movement. Primary motor, we have here homunculus, like different part, representation of different part of our body inside this primary motor cortex. You see that the biggest part take our tongue, our face, and our arms. Arm and hands, better to say hands. Premotor area responsible for generation of planning movements. It's about our plan, not only what we are doing, but creation of plan. And additional motor cortex created a complex of the coordinated movements. And example of the question, patient got a trauma that caused dysfunction of motor center regulation activity of head muscles. In what parts of cerebral cortex is the respective center normally localized? We are talking about inferior part of precentral gyrus. And we are talking, you see, about head muscles, so we are talking about inferior part. And I would like to tell you about autonomic nervous system. Autonomic nervous system, we should say about what? Sympathetic parasympathetic system. Inside of Krok question, so often I hear from my students, they had question about autonomic nervous system. This classic question, so much you will find there. Sympathetic and parasympathetic system. Normally we say that we have three parts: sympathetic, parasympathetic, and metasympathetic. In old European books, you could find only sympathetic and parasympathetic system because they not accept metasympathetic system, but already it's proved that this is separated system and it's working independently on parasympathetic nervous system. So if we will compare with you somatic and autonomic regulation, somatic is voluntary, so we can control it, but autonomic involuntary. Unfortunately, or for good luck for us, We are not able to control our heartbeat or make intensification work of our kidney by our thinking or by our desire. It's not possible. It's working and regulated involuntary by autonomic nervous system. Somatic system control our skeletal muscle, autonomic control smooth muscle, cardiac muscle, glands. Somatic consists of single efferent neuron, autonomic multiply efferent neuron. I will show you. Main neurotransmitter somatic systems, this is acetylcholine. When we are talking about autonomic, here acetylcholine and norepinephrine. Norepinephrine, this is important. Somatic, always excitatory, because doesn't have any sense to send inhibitory signal to muscle. It's not possible. Inhibition happens only in central nervous system. Autonomic can be and excitatory and inhibitory. Somatic controlled by cerebrum, but autonomic control by the higher level control of autonomic system is hypothalamus. The higher integrative center of regulation. But I will remind you that when we are talking about parasympathetic and sympathetic system, as usually they work for opposite to each other. Parasympathetic system rest and digest. Rest and digest. Here we have with you inhibition most of all function of our body. Only two systems are excited during parasympathetic domination. This is digestive system one, and this is our sexual system. Our sexual gland activated under parasympathetic system. Opposite system is sympathetic one. Sympathetic one increase activation or activated all of our system. This is system fight or flight. Please, you should remember this. Sympathetic fight or flight, parasympathetic rest and digest. And this time you will very good memorize what is going on during activation one or other one department, one or other one part of nervous system. Sympathetic fight or flight, it means that we should be ready for fighting or run away. This time what we have increasing heart rate, body temperature, catabolic process, because we need energy, respiration, we have with you everything, all processes are activated for we will be ready to save our life. Will be increase circulation in our skeleton muscles also. But digestive system is decreased its activity. That's why when we are all time have with you stress, this time we will not have normal digestion. These absolutely important things. The higher center control of sympathetic parasympathetic system is hypothalamus. Higher central for visceral function. By the way, hypothalamus is also higher center, not only nervous control of visceral function, but humoral also. And by the way, important moment, hypothalamus is a part of our limbic system of our brain. It means that hypothalamus responsible for emotion, for our memory participate inside this process also. That's why our emotion can induce influence upside our body. We, through the emotion, can be increase our heart rate or decrease heart rate. Our emotional state absolutely has direct influence on our visceral function. Hypothalamus, heart activity, blood pressure, body temperature, responsible water balance, endocrine activity, emotional stage, what I say you, and like rage, pleasure, and biological drives like hunger, thirst, sex. Reaction to fear on the fight or flight system, it's also about hypothalamus. One second. Here is picture. I would like to show you, let's look what we have with you. Efferent part of autonomic nervous system consists of few neurons. First neuron located in a spinal cord or in brain stem for sympathetic parasympathetic. It's named as preganglionic neuron. Second one, postganglionic neuron, located inside peripheral ganglion. Peripheral ganglion, this is summation of some neural cells where we have processing of some neural signal. Let's look next picture. So many questions from this picture you could find in Krok exam. Look, upside, this is somatic reflex. One neuron, I told you. One neuron, one efferent neuron from the CNS moves to our skeleton muscles. Always neurotransmitter acetylcholine and always receptors nicotinic acetylcholine receptors. Nicotinic acetylcholine receptors. But when we are talking about autonomic nervous system, we are talking about parasympathetic and sympathetic system. Parasympathetic system, preganglionic fiber, longest, postganglionic, so short. This is important, so short. And in ganglion, we have connection through the acetylcholine and nicotinic acetylcholine receptors. Nicotinic acetylcholine receptors. Sympathetic system, ganglion located nearly spinal cord. Sympathetic centers located only in spinal cord, ganglion nearly spinal cord, and again neurotransmitter acetylcholine and nicotinic acetylcholine receptors. That's why if you will have question how we are able to block all our autonomic nervous system, we should answer with you that we should use blocker of nicotinic acetylcholine receptors. Blocker of acetylcholine receptors. But important for us that postganglionic fiber for sympathetic system release norepinephrine. Or we say noradrenaline. Norepinephrine, noradrenaline, same. Activate, induce activation of alpha and beta adrenergic receptors. Alpha and beta adrenergic receptors. We have also with you one more example, action of sympathetic nervous system due to activation of adrenal gland. adrenal gland, their medular part of adrenal gland, we are talking about activation sympatho-adrenal system. Because as usually we are talking not about sympathetic system, we are talking about sympatho-adrenal system. What does it mean? That sympathetic nervous system of stress induce activation of adrenal gland. Adrenal gland will release adrenaline on our blood. This system, humoral and nervous regulations, it's working together, completed. And important moment, a preganglionic neuron moves to medulla of adrenal gland, release there acetylcholine. Acetylcholine activate nicotinic acetylcholine receptors, and chromaffin cells of medulla release epinephrine or adrenaline in the blood. As a result, we will have increasing function of sympathetic system. Let's look example of function. Sympathetic, as usually, it has antagonistic effect. Sympathetic nervous system, heart beating, increase, parasympathetic decrease. Diameter of pupil, also for you not mix it in your life. When we are feeling fear, when we are afraid of something, our eyes pupil, what? Dilated. Eyes like biggest. When we excited by something, when we are falling in love, our eyes biggest, our pupil widest. When we are talking about state of rest, about quiet, about relaxation, our pupil is are constricted, smallest. Or it could be also reaction for the sun. For the sunshine, because under sunshine our pupil is constricted, in the darkness is dilated. But if you are in system of stress, in the state of stress, doesn't matter the sunshine, your pupil will be dilated. Defecation, this is what I say you, that sympathetic system decreased working of digestive system, decrease all, and also of course decrease motility. Parasympathetic system increase motility, leads to explosion of stool. That's why people who all time in state of stress, they have problem with motility of intestine. Second important moment, dual effect. When we are talking about dual effect, we are talking about salivary gland. If previous we talking about antagonistic effect, here is dual effect. Dual effect, we are talking about salivary gland. Also, you can find like this question. Here is not antagonistic effect because sympathetic and parasympathetic system induce stimulation of salivation. Only when we are talking about sympathetic, we are talking about production acid mucus secretion. But parasympathetic, we are talking about clear watery serous secretion, because parasympathetic we need for digestion, sympathetic we are feeling like dry inside of our mouth. This case we have increasing level of protective enzyme and immunoglobulins inside of our saliva. Without dual innervation, also important question. If we are talking about only monoinnervation, only sympathetic innervation, we have for adrenal medulla, for sweat gland, and most of blood vessels. Important moment. Only sympathetic system has influence for adrenal medulla, releasing adrenaline only under sympathetic system. Inhibition, this process not possible. Sweat glands, we cannot decreasing our sweating. If we are nervous, this time they are working. If we are relaxed, they are not working. Or if we are feeling heat, so hot, this time we have activation of sweat glands. And most of blood vessels not receive signal from parasympathetic system. Only sympathetic. That why when we are talking about regulation of blood pressure, we are talking about sympathetic activation, because parasympathetic system could able to decrease heart rate but not able to dilate of our blood vessels. Important moment, please also pay attention. I found many questions. Maybe it's from pharmacology, but I found many questions about acetylcholine esterase and monoamine oxidase. I don't know you. I think in biochemistry and pharmacology you also have this question, but I want to pay your attention. Acetylcholine esterase, this enzyme which divided our acetylcholine upside of the receptors in the synaptic cleft and divided acetylcholine for choline and acetate. Choline moves back to the presynaptic part. Acetate moves out of our body. Type of acetylcholine receptors, muscarinic receptors, upside our organs. M1, M2, M3, M4, M5. M1, central nervous system, responsible for secretion, cognitive function, and so on. Adrenergic receptors, adrenergic receptors. We have with you alpha and beta. When we are talking about monoamine oxidase, is enzymes that plays role in breaking down of neurotransmitters like serotonin, dopamine, norepinephrine. Acetylcholine esterase for acetylcholine, monoamine oxidase about serotonin, dopamine, norepinephrine. This is neurotransmitter, first of all, of sympathetic nervous system. Receptors, alpha, beta. Alpha, contraction of smooth muscles. Alpha 2, salivary glands. Beta 1, renin release. Beta 2, dilation of eye, bronchi, uterus, bladders, arteries, gastrointestinal tractus, lungs. Beta 3, lipolysis in adipocytes tissue. By the way, now they are talking about beta 4 also, and even discovered beta 5 type of receptors. As usually, alpha 1, beta 1 are excitatory, alpha 2, beta 2 as usually inhibitory neurotransmitters, receptors, sorry. Sympathetic division, example of question. A man present with increased heart rate, mediatic pupils, and dry mouth. This condition results from the activation of the following system. We know with you already this sympathetic system. Location centers, tarasa lumbar part. This is catabolic system, induced catabolic process, named as E division. E division, exercise, excitement, emergency, embarrassment. This time we have activation of sympathetic system. Location of central cells, T1L2, T1L2. And that why I told you that second neuron located is usually in paravertebral ganglia, sometimes in prevertebral ganglia. They located little far from spinal cord. Parasympathetic system, craniosacral system, cholinergic system, main neurotransmitter only acetylcholine. This is nervous system of tomorrow, relaxation and renewing. Anabolic system. This system induces anabolism. Trophotropic system, division, digestion, defecation, stool, diuresis. This all controlled and stimulated under parasympathetic system. Example, after patient had taken blocking agent, his heart rate is increased. Pressing on the eyeballs didn't result in the expected refractory decrease in heart rate. What exactly was blocked by drug in the pacemaker cell? We are talking about blocking of parasympathetic system. If we want to block only parasympathetic system, we should to block M cholinergic receptors. If we want to block and sympathetic and parasympathetic systems at the same time, we will block nicotinic acetylcholine receptors. And main influence from parasympathetic system, main influences 80% of parasympathetic system. This is nervus vagus, main nerve of parasympathetic system. But inside Krok test, you could find like next question. Look, please. This like inside this question about patient, what they mean when they say pressing on eyeballs, two hands. We should press with you, and I don't know, maybe you forget already, but when we press on eyeballs by our fingers, this time heart rate should be decreased. Heart rate should be decreased. Why? Because this visceral reflex, and we are talking about activation of vagus nerve. This reflex named as Danini-Ashner reflex. Danini-Ashner reflex, after irritation by ophthalmic nerve, we have like connection to trigeminal, this is ophthalmic part of trigeminal nerve will send signal to the sensory nuclei of trigeminal nerve. A sensory nuclei of trigeminal nerve has contact to dorsal nuclei of vagus nerve. Vagus induce activation, receive activation, and send signal to the heart. Effect of the vagus on the heart is decreasing force and frequency of heart contraction. That's all. That's why a fixed run taxi passenger has a sudden and expressed attack of tachycardia. A doctor traveling by the same taxi has managed to slow down his heart rate by pressing upon the eyeballs. Very good method if you are so much nervous for make you quiet, for decrease tachycardia. We can use this Danini-Ashner reflex. And when we are tired or when we are worried about something, automatically, so often we begin to touching our eyeballs. And one more example I want to give you. This interesting also reflex, and you see that this we are talking about traffic accident and about belt. You see, belt can push our visceral organs during emergency stop. And interesting that we have also afferent way, because internal organs, most of them receive information from vagus nerve, and afferent way by vagus moves to the vagus nuclei, and efferent way will be moved to the heart. And because of like this accident or another, how I will show you in our question, uh, can be decrease or even stop heartbeats for some period, but after it will be renewed. During sport competition, a boxer received a strong blow to the abdomen, which caused a knockout due to a brief drop in blood pressure. What physiological mechanisms are the cause of this condition? We are talking about stimulation of parasympathetic nerve, about parasympathetic nerve. And I would like to show you, look please, afferent inputs from different our organs through the brain and induce activation of parasympathetic system. Look, trigeminal nerve, this is from eyes, chemoreceptors, this about heart rate controlling, if increase concentration CO2, oxygen, if we are talking about increasing blood pressure in our carotid sinus, if we are talking about lung activation from visceral organ, how I showed to you, all of that can have influences on the cardiovascular system or cardiovagal parasympathetic activity. Will have activation of vagus. Vagus will induce inhibition of the heart activity. Few words and I will make you free. Autonomic nervous system, general conclusion, adrenergic, increase heart rate, cholinergic, decrease. Broncha delays, adrenergic, also not mixed, please, because when we need save our life, when we have stress factors, of course, this time we need good breathing. When we need good breathing, our bronchi should be dilated. Dilate of pupils, decrease of GI tract, and decrease lacrimation, decrease urination. Cholinergic system opposite, increase urination, lacrimation, increase work of gastrointestinal tract, constrict of pupils, bronchoconstricts, and decrease heart rate. So, adrenergic system fight or flight, cholinergic, this rest and digest. And by the way, I want to give you example from animals because it's usually people normally we should have balance between sympathetic and parasympathetic system, but most of us we have like prevaluation of a sympathetic system or parasympathetic. We have special test for determine what a system prevaluate for you personally, but I would like to show you as example for animals. If we are talking about horses, normally for horses, they have prevaluation of adrenal system, sympathetic system. But cow, as usually, they all time eating, they all time chewing, as usually they most of time quiet because in their body have prevaluation and domination of parasympathetic system rest and digest. And few words about enteric nervous system or parasympathetic system. This system consists of complex independent neurons and reflectory arc. This system work as usually inside our gut, inside of our gut, and control of motility and blood flow. We have like 7 meters of our gut and different process there is going on. That's why it's so hard to control only under our brain, under central nervous system. It's not possible. That's why it's working because of enteric nervous system. And there we have different neurons, different reflectory arch, different neurotransmitters, not only acetylcholine, but VIP, intestinal polypeptide, and NO, and different other neurotransmitters. This everything working independent. If we will close with you and like closed, will inhibit it nicotinic acetylcholine receptor and will be stop influence from sympathetic and parasympathetic system, our intestine will continue work by itself, because of activation of metasympathetic or enteric nervous system.